Welcome to Lifestyle Matters. I'm Marilyn Moore. Today we have Dr. Nuzzo with us, who is an orthopedic surgeon specializing in sports medicine here at Fresno Surgical Hospital. Doctor, thanks for joining us.
Thank you for having me.
Tell us more about what you do here. What does an orthopedic surgeon do?
Well, an orthopedic surgeon in general treats injuries to joints or the musculoskeletal system. I specialize in sports medicine. I'm fellowship trained in it, which means I provide specialized care for sports-related injuries.
Why did you choose sports medicine?
Well, in particular, it's the types of surgeries. Most of the surgeries are done arthroscopically, which means it's done through a camera and small incisions and specialized instrumentation.
Tell me more about that. I think that is just so fascinating. What is your role? What are you doing exactly?
Well, we treat a lot of injuries. Mainly, I treat injuries to the shoulder, the hip, the knee, and the ankle through, as I said, through a camera and small incisions or arthroscopically. I like that minimally invasive part of the surgery. The surgeries themselves are very gratifying because you treat a lot of athletes who are able to return to their sports after injuries. What
are the main surgeries, that you find yourself doing?
Mostly arthroscopic shoulder surgeries, so from injuries in sports, or even as you get older, you can have rotator cuff tears. In the hip, I do a lot of hip arthroscopy, which is an up-and-coming procedure to treat impingement and damage cartilage and a structure called the labrum inside the hip joint. In the knees, it's a lot of ligament reconstructions similar to the ankle.
Now, how do you get to that point? Because when I think of hip joints, I'm thinking, elderly, you always have to be careful when you're older with your hips, but are you seeing that a lot in sports?
Well, it's true. You can develop arthritis in the joint later in life, but athletes develop or can get something called a labrum tear, which is a gasket-like structure in the hip that can tear from rigorous use. Sometimes it's torn through impinging bone that can, in effect, tear the labrum. And so arthroscopically, we're able to go in with a camera and small incisions to repair the tears that occur, correct some of the damage inside the joint, and also shave down some of the bone to correct from that impingement from recurring in the future, which in theory can prevent the possible need for hip replacement in the future.
And what are you seeing, the outcome typically is?
In most athletes, you see very good outcomes. You see them get back to their previous level of play without pain.
And what exactly, take me through a day here at Fresno Surgical Hospital.
Well, a typical day, we have several surgeries that we do, different kinds of surgeries. Quite often they are hip arthroscopy surgeries. And the patient comes in, they are anesthetized and put to sleep. During the surgical process, we distract the hip a little bit to get into the joint and do our work. Most likely it would be a repair of the labrum, shaving down a little bit of that bone. Again, it's done through very small incisions in the camera and the specialized instrumentation. And then after recovery, they're able to walk right away. We see them a week or so later in the clinic, and then we begin physical therapy. And in general, most athletes are back to their sports within 3 or 4 months.
That's amazing. Now, how long does this surgery actually take?
It takes me roughly about an hour to do.
And what do you just love about being an orthopedic surgeon specializing in sports medicine?
Well, particularly gratifying is to see these injured athletes, athletes of all ages, get back in all stages of life, get back to their previous level of activity. In my case, a lot of times it's athletes who are able to return to their scholarships in college, in sports level, high school athletes, or even the weekend athlete who is, just wanting to get back to tennis or basketball or something, and they are very grateful, and it's a very satisfying part of my profession.
I can tell on your face how gratifying that is. Now, what about Fresno Surgical Hospital? Why do you enjoy working here?
Well, Fresno Surgical Hospital has a lot of benefits. Part of it is the hardworking staff, the nurses and technicians that make my day much easier. and it's very gratifying to work with great people like that. But also, Fresno Surgical Hospital has invested heavily in state-of-the-art arthroscopic equipment, and that makes my job a lot easier. It makes my work product better, and in virtue, I think it makes the patient's outcomes much more successful.
Well, Dr. Nuzzo, it was great talking with you and learning about what you do. Thank you so much.
Thank you.
We have been at Fresno Surgical Hospital with Dr. Nuzzo. I'm Marilyn Moore, and you're watching Lifestyle Matters.